Over 10 million people worldwide live with Parkinson's disease. It can be a daunting diagnosis, and the future may seem uncertain. This essay seeks to provide information and hope. Parkinson's is a progressive neurological disorder, which means it affects the brain and nervous system. It primarily impacts movement, causing tremors, stiffness, and difficulty with balance. While there is no cure, treatments can manage symptoms and improve quality of life. This essay will guide you through the intricacies of Parkinson's disease. We will explore its causes, symptoms, and available treatment options. We will also look at emerging research and discuss whether Parkinson's can be prevented. Parkinson's disease is classified as a neurodegenerative disorder. This means it causes the gradual loss of specific brain cells over time. These cells, located in a region called the substantia nigra, are responsible for producing dopamine. Dopamine is a vital chemical messenger. It transmits signals between nerve cells. These signals control smooth, coordinated movement. As Parkinson's progresses and more dopamine-producing cells are lost, the brain receives fewer of these crucial movement signals. The decline in dopamine disrupts the brain's ability to regulate movement, resulting in the characteristic motor symptoms of Parkinson's. Parkinson's disease often manifests subtly, with symptoms gradually emerging over time. Early signs can be easily overlooked or attributed to other factors. The most well-known symptom is tremors, which are involuntary shaking movements, often beginning in the hands or fingers. Another hallmark is bradykinesia, a slowing down of movement. This can make everyday tasks like walking, talking, and dressing challenging. Rigidity or stiffness in the limbs and trunk is another common symptom. This can limit range of motion and cause discomfort. Postural instability, leading to balance problems and an increased risk of falls, often develops as the disease progresses. Despite extensive research, the exact causes of Parkinson's disease remain elusive. The disease likely arises from a complex interplay of genetic predisposition and environmental factors. One hallmark of Parkinson's is the accumulation of a protein called alpha-synuclein in the brain. These proteins clump together, forming what are known as Lewy bodies. Lewy bodies disrupt the normal function of brain cells, eventually leading to their death. While the exact cause of this protein buildup is unknown, it is believed that both genetic mutations and environmental triggers may play a role. Section 5. Risk factors. Who is more likely to develop Parkinson's? While the exact causes of Parkinson's are not fully understood, several risk factors have been identified. Age is a significant factor, with most cases developing after the age of 60. Men are slightly more prone to developing Parkinson's than women. Family history also plays a role. Having a close relative with the disease increases your risk. Exposure to certain environmental factors such as pesticides and herbicides has been linked to an increased risk of Parkinson's. Additionally, head trauma, particularly repeated concussions, may increase the likelihood of developing the disease. Section 6. Treatment approaches for Parkinson's disease. Currently, there is no cure for Parkinson's disease. However, a range of treatments can help manage the symptoms and improve quality of life. Medications form the cornerstone of Parkinson's treatment. Levodopa, a drug that the brain converts into dopamine, is often the first line of treatment. Other medications such as dopamine agonists and MAO-B inhibitors can help boost dopamine levels or prolong the effects of levodopa. In some cases, surgical therapies like deep brain stimulation or DBS may be considered. DBS involves implanting electrodes in specific areas of the brain to regulate electrical activity and alleviate motor symptoms. Section 7. Can Parkinson's be prevented? As the exact causes of Parkinson's are still being investigated, definitive preventative measures remain elusive. However, research suggests that certain lifestyle factors may play a role in reducing risk. Regular exercise has been shown to have neuroprotective effects, potentially lowering the risk of developing Parkinson's. A healthy diet, rich in fruits, vegetables, and antioxidants, may also offer some protection. Some studies suggest that coffee and tea consumption may be linked to a lower risk of Parkinson's. However, more research is needed to confirm these findings and establish a causal link. Section 8. Recent research and breakthroughs. The field of Parkinson's research is constantly evolving, offering new hope for treatments and, ultimately, a cure. One promising area of research is stem cell therapy. Stem cells have the potential to develop into dopamine-producing cells, potentially replacing those lost in Parkinson's. Clinical trials are underway to assess the safety and efficacy of this approach. Another exciting avenue is the development of alpha-synuclein vaccines. These vaccines aim to trigger the immune system to target and clear the abnormal protein clumps associated with Parkinson's. Section 9. Conclusion. Living with Parkinson's. Parkinson's disease is a complex and challenging condition. While it presents unique challenges, a positive outlook, coupled with comprehensive medical care and lifestyle modifications, can significantly improve the quality of life for individuals living with this disease. Early diagnosis and timely treatment are crucial to managing symptoms and slowing progression. Staying informed about the disease, advocating for research and supporting organizations dedicated to finding a cure are vital steps in the fight against Parkinson's.